Okay, good morning, everybody. Thanks for joining us for today's highlights. Today is April 20th, and I'm by myself today. So Dr. Stephanie Taylor is actually taking part of the Earth Day 2020 teleconference with Ashrae. The topic for that talk is resiliency and sustainability in the age of SARS-CoV-2. So she's unavailable for today, but we'll be back on Wednesday at 10:30. And for today's topic, we're going to go through the Ashrae position document on infectious aerosols. So this was finally published, believe it was April 17th when it was finally published on Ashrae's website. But as you can see, it was fully fixed up and finished on April 14th here. And it's good for the next 3 years. So after that, they'll have an additional update. So I'm just going to take you through the document and see where exactly it addresses humidification and the need for it in hospitals and other buildings. So it first mentions humidity control in the abstract, actually. So as soon as they start listing off ways to contain infectious particles and pathogens, it's mentioned right away, along with airflow distribution, pressurization, mechanical filtration, and UVGI as other effective strategies. So we're right up there, and everything else is contained from there on. So the position document is actually a great step forward from Ashrae. It completely recognizes the 3 factors that can increase infections due to the low humidity. So number 1 being, of course, further travel distances of those pathogens. In dry relative humidity, those droplets and those droplet nuclei shrink down right down to microscopic sizes and can float around for hours and hours and can travel much longer distances. When you get up to past 40%, like we've said for a long time, they aren't able to shrink and their settling time is much, much shorter. The second point that they mentioned, the second factor, is that there's higher infectivity at humidities below 40%. And they rated the study that proved this as a level B. A is the top, so B is the second, and where A they fully recommend to follow, and B is more of a check out this recommendation. We don't give a specific recommendation on how to control it, but you should take this into account while building your space. And then third, they also recognize that there's a reduced effectiveness of our own immune system in dry air. So having all 3 of these is a huge step forward for Ashrae. And unfortunately, though, they do not recommend taking them. They don't give a definitive recommendation on humidity levels. But what they do say in this document is that all of these should be taken into consideration by the engineer and to look up and follow that evidence and those studies. So it's more of a holistic approach that they've given. So they've provided all of the data flat out. Here it is, and you need to make your own decision as an engineer. So if we look back on the timeline of Ashrae and what their recommendations are, this position document in 2009 only mentioned humidity 1 time. In 2014, that grew to mention it 28 times, and that hospitals should be prepared to increase relative humidity levels in case of a pandemic. And then today's document mentions relative humidity 31 times. It's established it as an important parameter for all human health, disease resistance, and for infectivity of microbes in the air and on surfaces. So that's also a big distinction here. So there have been huge steps even between each one of these position documents. And so this is a big victory for all of our agents that work with us. Anyone studying this and looking and trying to prevent infections in hospitals and all buildings, and really just shows the progression of Ashrae and their open mind to take into all of this, all of these studies and all of the research here. So it is a big achievement here. So I want to just address their final commitment, one of their commitments in the document. So they wrote down that they want to partner with infection prevention, infectious disease, and occupational health experts and building owners to evaluate emergent control strategies and provide evidence-based recommendations. And this is a great path forward as well, and really shows that they're open to these recommendations and open to looking at new studies and new data brought forward for really trying to create buildings that are for the occupants here. And so great step forward from Ashrae. The link to the position document I posted in the comments, and we have it here as well. And I just want to say thanks for joining, everyone, and we'll be back on Wednesday at 10:30 with Dr. Taylor. Make sure to continue to follow her on LinkedIn, and Ashrae should have that teleconference available. I know it was a paid attendance section, but it's not only her in there as well. There's other experts involved on that field, so there should be some good discussion involved there. So I encourage you to look it up and try and get a copy of it. All right, thanks for joining, everyone.